Hi everyone, I'm Candace. I'm a senior nursing student at Aspen University, and I want to talk to you about a clinical problem that I have observed while in clinicals and at my place of employment. Everyone knows that I work with children, and but I've also seen it in adults as well. What I've seen is pediatrics and adults that have intellectual disabilities were not as supportive as we could be to these patients and caregivers while they're in the hospital. So what I would like to do is I want to give you like a real life scenario, and then I'll go into the research and why this is such an issue. So say you're the new nurse and you're coming on to get report. You have 4 patients that day and you have 4 different nurses to get report. I know. Oh my goodness. Like your day is bad already. Nurse number one. Nurse number one says, oh, this kid is DD and is total care. But don't worry, mom does everything. You don't need to do anything but give meds. The second nurse says, oh, this kid has intellectual disabilities and like they have to be gotten up into the chair and they have to be fed. But don't worry, their grandma, she comes in and she does everything. You don't have to worry about him on day shift. Get to your third nurse. Your third nurse says, this kid is DD. This kid, you don't have to do anything. Dad comes in and he's great. Then you get to your fourth nurse. Your fourth nurse said, this mom cares about her kid so much she hasn't been able to sleep. This kid has been sick for 10 days before she brought him to the hospital, and mom and patient are both exhausted. This kid is a total care. He has intellectual disabilities, and this family is going to require a bit more hands-on care today. This nurse is the first nurse that has acknowledged that we need to do more helping. I always hear when I come to sit with a kid for pulling lines, or I overhear the nurses doing report that, oh, don't worry, the parents got it. And I've heard parents say that they do not feel that they are supported enough with these types of patients, because all the nurse comes in is does the meds and the tube feeding and then steps out. The tech will come in and offer to help change the patient, but other than that, they're not really helping. They're not helping bathe the patient. Sometimes they're not getting changed as frequently as the family would do at home. So the family feels that they have to be in the role of the parent, the caregiver, and they have to be there to make sure that their child's care is being done correctly, because they don't feel that they are being listened to when they are first admitted. How I would bring about a change to this, to my practice for this, I would during the admissions for these kids, I would have like a 10, like even just a 5 to 10 questions for the parents to fill out, how we could best support them during their stay, and the favorite things that help make their child and them more comfortable during their hospital stay. And then upon discharge, I would have them rate their stay according to that questionnaire that they filled out in the beginning. What kind of theoretical model do I think I would use? I think the best model that I could use is the cognition theoretical model. This is basically used to acquire knowledge, and this is what I want. I want to see how these parents are feeling, and I want to know what we could do to make their hospital stay better for them and better for their child, or even an older adult with intellectual disabilities, their caregiver, like how could we make this a better hospital stay for them. So I want to see what is different with these kids that have, or adults that have intellectual disabilities. What is different than a child or an adult without? How do we treat them different? Are we limiting them? Are we not being as supportive as we can? What could we do to make the difference? I want to observe how staff interacts with them. I want to observe how the parents feel, all of those things, and then I would want to study all of those answers. That would be how I would bring about that change, and what models I would use to help me overcome those barriers. And then what sources of internal evidence will I use in providing data to demonstrate improvements? So after the parents fill out this survey, or rather questionnaire, to help me better understand their child, I would have them fill them. I would have them fill one out at the end of their stay. That way, I have the outcomes um, of their stay after implementing that survey at the beginning. That would let me know that that what they suggested, once that's put into practice, that would let me know how well it did. Did it help solve the issue? Did they feel like they were more supported? Um, did it not change? Did it change a lot? Did it only change a little? Did it only change depending on who was on shift that day? You know, there's multiple areas that could be looked at. Um, is there any ethical considerations? I know some families feel that it's their duty to take care of their kids. It's nobody else's responsibility. But I also know that parents have other children at home, and they worry that while their one child is in the hospital, that they are neglecting their family at home. Um, if they stay with their kids at home, then their kid in the hospital isn't getting taken care of. So I really feel like if a parent could fill out this 5 to 10 questionnaire about their child, and it would be like a parent care plan that the nurse could follow, and every shift the nurse, could ask questions based off of the responses to this questionnaire and help come up with a plan. And that way we could kind of move away from, oh, don't worry, mom does everything. Because, yeah, us moms, we're pretty cool. We're pretty tough. But even us moms get tired, and we all know how tired children can wear us out. And thinking about a tired child with an intellectual disability who doesn't understand why they've been removed from their environment, it's like taking a dementia patient and putting them in the hospital. Children with DD or intellectual disabilities are along those same lines. They don't understand. They've been taken out of familiar environment. So we need to keep them to their schedule, to their medication schedule, their feeding schedule, their changing schedule, them getting up into their wheelchair. We need to keep that as close to normal as possible for them to make their hospital stay better. I would really, the biggest change I'm looking for in implementing this would be the changes in the nursing staff. Nursing work can be exhausting, and we are so busy. I really would not want to stress nurses out further and make them feel like they're not doing their job. However, I feel like this is just a really big area that we're lacking, and I have had so many moms be grateful that me and a nurse were willing to do the bed bath, or do the changing, or do the feeding schedule, or do those things beyond what nurses do, beyond just giving the medications or just giving the feeding. And then you hear that for the last week that the mom has been doing everything but the meds, and then you find out that the medication schedule that the hospital put the kid on is so far away from what they've done at home that it's not practical, and that the child will have to stay longer so you can get them closer to their home regimen. So I feel like there's not too many ethical barriers, but there's just enough that it would definitely take a lot more thought in. And I just feel that this is a very important part of nursing, because individuals with developmental disabilities or intellectual disabilities are living longer lives due to advancements in medicine. And we, along with the advancements in medicine, a lot of these individuals are having more complicated health histories, more complicated health problems. They're having to have more procedures done. They're spending more times in the hospitals. And so I just think this is something important to look at and research and implement a practice change. I do know that just as a tech right now, I try to make sure that I offer help to those families. Maybe not more so, but just make it more apparent that yes, I'm here to help you. If you need anything, let me know. And but I really think a questionnaire and just laying out those care guidelines would make a big difference in how these patients' hospital stays would go. Well, I hope you enjoyed my TED Talk and have a wonderful break. Thank you.